Hi, I'm Dr. Chris Gubbels from SquareOne Health, and today I'm going to give you 7 tips about treating low back pain. Now, low back pain is a really big deal worldwide, and especially in the United States. Low back pain is actually the #1 musculoskeletal complaint, and it's also the #1 cause of disability worldwide. It's the #1 cause of work absenteeism, meaning the #1 reason people miss work, and it's also the #1 cause that people lose the ability to do their normal daily activities, things they do in everyday life. So I guess the overall, probably the biggest tip is you have to find out what's causing your low back pain so you know how to effectively treat it. Because you don't just want to treat the symptom, you want to find out what's causing it and you want to fix the cause. So what we're really going over today is kind of the 7 main causes of low back pain and then what to do about those. So let's dive into this. #1, misalignment. Now, when I'm talking about misalignment of the spine, I'm not talking about an individual vertebrae being out of place. I'm talking about whole sections of your spine. So in a normal spine, your spine should be straight from the side, from the front. And you should have a curve in your low back, mid back, and neck. And you can get too much curve from the side or you can lose that. Now, here's a little expert tip. If you go to a provider, you want to ask them, can they match your pelvic incidence to the curve in your low back? Pelvic incidence is how experts measure the size of your pelvis and determine how much curve you should have in your low back. And from that information, a proper rehab program can be put in place to correct your normal alignment. Now, only true experts are going to understand this and know how to evaluate that. So that's one way you're going to know if you're dealing with a true expert. #2 is anatomical leg length inequality, where you have one leg that's shorter than the other. Now, most people's legs are not the exact same length, but if it becomes big enough where your pelvis tilts, probably more than 5 to 10 millimeters on one side, that's enough that can cause chronic low back pain. It can cause disc herniations, disc bulges, and some parts of your spine to break down. So you need to go to someone that knows how to do a proper x-ray to analyze and measure your leg length. 3, weight loss. We know that if you're overweight, especially if you're obese, that contributes to low back pain. So if you are overweight, you may need to lose some weight to actually help effectively treat your low back pain. And specifically, you want to go to some place that has a medically supervised weight loss program, because those have been shown to be the most effective in losing weight effectively and rapidly for low back pain reduction. 4, stability. We're talking about core stability. Now, that could be a lot of things. That could be your upper abdominals, your lower abdominals, your internal abdominals. It could be your rector, your low back, paraspinal muscles. So to find out which of these need strengthened, you have to do a detailed functional exam to find out the exact muscles that are weak or not functioning right. So a rehab program can be designed to get the very specific muscles to start working better and to get stronger. Along with that, we look at stability. We have to look at flexibility. Flexibility is how, if your muscles have the normal length to them or if they're very tight. When it comes to low back pain, there's a few areas you're going to want to look at. You're going to look at your abdominal muscles, your hip flexors, your low back erector muscles, and your glutes and hamstrings. And then based on which ones are tight, a specific program can be put together to increase the length of those and increase your flexibility. Here at SquareOne, we do a detailed functional exam of all our patients. We're going to find out which muscles are weak and which ones are tight and which ones those need to be corrected, and we'll design a program to fix those individual needs. Mobility. Mobility is a little different than flexibility. Mobility has to do with how the individual joints are moving. Now, when joints get locked up or not moving, that's what chiropractors call subluxations. We know that's a major contributor to low back pain. This is what chiropractors are really good at treating. Basically, what happens is when your joints don't move, these joints have receptors that sends a stress signal to your brain that causes pain. And with chiropractic adjustments, we get those joints to move properly, and that creates something called proprioception, or a positive signal, and that positive signal shuts down or dampens the stress signal. So going to a chiropractor to get those joints moving properly, chiropractors are the most highly trained experts at getting individual joints to move with adjustments. And the last one is you may need something called decompression, because another common cause of back pain is degeneration in the disc, where you're losing the disc height, or you could have a disc bulge or a herniation. And decompression is where you use specialized equipment. It's a computerized table that actually will distract and literally decompress the spine, and it creates a pumping motion to help rehydrate those discs to get space in there to help decrease the pain, decrease inflammation, decrease muscle spasms, and get pressure off the nerve. So just real quick, I went over 7 different tips, 7 different causes of back pain, and 7 different treatments. So really, you need to get yourself to an expert that knows how to properly evaluate your spine. So based on what's causing your back pain, you can get the most appropriate and specific treatment to fix the cause, not just help you temporarily feel better. So I'm Dr. Chris Gubbels at SquareOne. If you're dealing with low back pain and you need help, just give our office a call, ask for a free consultation, or look for other videos where we deep dive into some of these specific causes and how we actually address those.